Okay. And namaste and good evening to Professor Dr. Ravindra PN, resource person of this evening, the viewers and participants for this webinar from across the country. Greetings to all of you. Let me first wish each one of you a happy, healthy, and disease-free new year. I have a great pleasure in welcoming you to yet another edition of this webinar, being organized by Vayomanasa Sanjeevani, an outreach arm of Geriatrics unit of NIMHANS, Banglaore. It is headed by Professor Dr. P.T. Shivakumar, who is ably supported by Dr. Preeti Sinha and Dr. Vijay Kumar Abhishattar, and a team of dedicated doctors. The back-end support for today is being provided by Mrs. Jyoti Gogoi, along with another student from another institution who is doing clinical psychology by name Jalak Sharma. So I welcome both of them for this meeting. As you may be aware, the entire program is being run by volunteers who do not get any material benefit out of this. The only motivating factor for them is the joy of being of service to the society and especially to the seniors. Before starting to introduce to you the resource person of this evening, I like to talk about the topic of today, namely meditation for healthy aging. As you may recollect, we have celebrated December 21, 2025 as the first International Meditation Day. This is because the United Nations has declared December 21st as the World Meditation Day to raise awareness of the benefits of meditation and the role in promoting mental and physical well-being. The day also acknowledges the link between meditation and yoga as complementary approaches to health and well-being. The UN chose December 21 for World Meditation Day because it marks the winter solstice, which is an auspicious time for meditation and inner reflections in Indian tradition. Then, incidentally, this happens to be the shortest day of the year. According to archaeologists, meditation dates back to 5000 before the Common Era, that is BCE, and the practice itself has ties to ancient Egypt and China, Judaism, Hinduism, Jainism, Sikhism, and Buddhism, as well as to Christianity and Islam. Estimates suggest that between 200 and 500 million people practice meditation worldwide. It is said that meditation can help reduce stress, blood pressure, and anxiety, promote emotional health, enhance self-awareness, and improve sleep. Let me now happily introduce the resource person of this evening, Professor Ravindra PN. He is currently working as the additional professor in Center for Conscious Studies, NIMHANS, Bangalore. He is a student of Karnataka Institute of Medical Sciences, Hubli, where he did his MBBS in the year 1999. He did his MD in the same institution and passed it in the year 2003. He had joined NIMHANS for his PhD studies on the topic sleep and meditation and obtained his PhD. He is currently working in the following areas: sleep and the effect of meditation practices, sleep in elderly with memory problems, cognition, emotion, perception in depression, and how yoga influences this. On the above topics, he has done many presentations at national and international levels. He has also won the National Award for his work on meditation and sleep. Many of us may be aware that in chapter 6 of Srimad Bhagavad Gita, Lord Sri Krishna talks elaborately about effects of meditation, various forms of meditations, and who will get what benefit out of meditation. Of course, we will reserve that topic for another day. Of course, we are today assembled here to know more about the science behind meditation, and that is established through research by the various organizations in the world. The agenda here today is to know the evidence-based results achieved through meditation across the world. We are today fortunate to hear from such an outstanding personality who have done and currently doing a lot of research and clinical work on meditation. I am sure Dr. Ravindra will clear all the mysteries surrounding meditation and the importance and its importance for healthy aging and all other relevant matters. The objectives of these webinars is that we listen to such qualified specialists, implement their suggestions in our lives, and age in a healthy way so that we can contribute to society even at our advanced age, instead of living as a burden on anyone. The basic hygiene that we follow in these webinars is to keep your mic on mute and raise any question you may have in the chat box for the resource person to respond to at the end of the presentation. I request all of you to follow it. I shall now introduce the gathering to the resource person. Dr. Saab, you may know that we are a set of seniors interested in keeping good health and age in a healthy way. We shall follow your instructions and guidelines and spread them to our families and friends so that anyone ages in a healthy way. Yes, doctor, the now floor is open to you. Kindly go ahead with your presentation. Thank you, doctor.
Thank you, sir. Thank you. Am I audible?
Yeah, you are audible, doctor.
Yeah. So thank you very much, and sorry for the technical glitches that has come. It was very unfortunate. So what I would like to do probably say next couple of minutes is try to give you a general overview of how meditation will be very helpful, and especially say from general overview of meditation and how it is very helpful for sleep. Now, so yeah, can I go for the next slide?
Yeah, Jyoti.
Yeah. Yes. So all of us, we know, the practice of meditation was deep inside in our culture, and it's a not only of the meditation, but every day we know, okay, we have our own way of religious and spiritual practices, okay, that we do every day. Maybe, I mean, so some of us, we may have a structured meditation practices in certain schools, or maybe we will be having, say, our own, say, the religious practices for every day. In either case, we have to keep it in mind. These things are very, very helpful for us, okay, to maintain our physical, emotional, mental, and spiritual well-being. So the first and foremost, what I want to tell to all of you is that whatever the practices that you people are practicing at this point of time, as your daily routine, okay, it can be if your religious practices or spiritual practices, right? You please continue with that. The effect of that, whether it is consciously perceptible or not, that's a different, the discussion altogether. But definitely, it has a lot of, say, influence on your mental and emotional well-being. Number one. Can I go for the next slide? No. Now, next slide, please. Now, see earlier, so some of the researchers when they carried out, you see, when you do any japa, meditation, chanting, okay, or breathing, say pranayama practices, what will happen? So certain important things that will happen is that, okay, it brings down your the metabolism. Now, what do you mean by metabolism? It means that your energy needs of your body will come down. Your heart rate will come. Your respiration rate will come down, right? So all things is going to come down. The same thing happens also during sleep. So therefore, earlier people thought doing meditation is the same as doing sleep, but it's not so. Why it is not so? It is as simple as that. That suppose, see, meditation practices or puja practices or your spiritual practices brings about a transformation in a person. But where the sleep will not bring about in any transformation in a person. That is very important. So that's the beauty of all these spiritual practices. Even though our heart rate, respiratory rate, and everything comes down like that of a sleep, but the transformation is not going to happen. So the transformation is very, very important. Next.
Next, ma.
Next slide. Next slide.
Jyoti, next slide, ma. Yeah.
Fine. Okay. So with for all your healthy aging to have, what are the things that is actually that is needed? I'll finish up. No, that is Geriatric. Right. So, hello, can you hear me?
Yes,
Yes, sir.
Yeah. So, whenever you do say the meditation practices or deep breathing practices, which is a part and parcel of our the comprehensive yoga practices, the overall thing what is going to happen? So it reduces your depression symptoms, it reduces your anxiety, reduces your negative symptoms, it increases the cognition, it increases the sleep, and it increases the attention. Now with old age, what are the things that probably it will be more, say, the problematic? First, you will have a sleep disturbance. That's the most common thing that happens for various reasons, right? And also there will be certain memory related issues. It can be where our recall of memory and everything will be reduced. And so we'll try to understand that, okay, with these practices, what can happen for sleep? And if the sleep improves, right, your memory also will improve, and your other symptoms like depression, anxiety, whatever the negative symptoms, it also reduces. So therefore, we have to understand that the symptoms that we have, like a depression or anxiety, right, and also for a sleep, they are all interrelated to each other. So the first and foremost thing that we have to understand that whenever we do a yoga or a pranayama or a meditation practices, the first thing that we will experience is okay, that we are feeling it very relaxed. And most important is our sleep will improve. Okay. Now, how it is going to happen, we will see. Next slide. Next. Okay.
Before that,
Yeah. So now, see, if you look at our sleep, see, our sleep will be okay. Is divided into many types with deep sleep state and REM sleep state. Now, deep sleep state is what you can see. If you can see here, you can see here like 1, 2, 3, 4. The 4 is a very deep sleep, and black bars is your REM sleep, where you get more and more dreaming. Now, what will happen with aging? My deep sleep comes down, and my REM sleep okay, will be there, but we'll get more intermittent awakenings. We'll try to get up in between more and more, and my deep sleep it reduces very significantly. So this is a normal process that happens, say, with aging. So therefore, when my deep sleep comes down, when I get up in the morning, I don't feel that I have felt very fresh. So therefore, you can see here in children, you have a more, say, deep sleep, and in elderly person, your stage 4 is completely nil. It is not at all there. Okay, it completely disappears. Okay, it will be there. Okay, fine. Next slide. Now, why this deep sleep is important? Deep sleep is important for various reasons. As I told you that this deep sleep is very important, okay, to maintain our immunity. Number one, deep sleep is important for our memory. Deep sleep is very important to uh, recuperate physically and mentally, okay, because of the stress or whatever the thing that we have undergone throughout the day. So if you can see over here, during deep sleep, right, whenever there is a surge of, say, the growth hormone, so that will really help us to uh, uh, bring about our to sensitize our immune cells. So therefore, whenever we are exposed to any small infection, right, and if that infection has to be it has to be fought, okay, with our immune cells, the sensitization of those immune cells, okay, for the antigen that we have exposed, it can be for bacteria, dust, virus, or whatever it is, it happens in deep sleep state. So one of the reason why also that the rate of infection for small, even for a small exposure, could probably increase with elderly is because so their deep sleep is also reducing. So now what is the importance of deep sleep? Deep sleep is important for our physical recuperation. Deep sleep is important for our memory. Deep sleep is important for to fine tune our uh, immunity. Okay, these three are very, very important. And deep sleep is very, very important for our cardiac and respiratory also, because because the cardiac and respiratory thing, it goes to a very deep rested state, okay, in our deep sleep state. So we have to understand that deep sleep is important, but deep sleep is what it reduces aging. So these are the two facts. Next slide. Now, with meditation, what 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 are the things that can happen? Now we have shown that with the good meditation practices, right, our deep sleep will is retained or it increases. Okay, so if you do a regular meditation can be anything. Okay, it can be your japa, it can be your say deep breathing practices, or even it can be your bhajan practices. Okay, whatever the spiritual practices that you do, if you do it very regularly every day, okay, then on a long term basis we have seen that okay, it will improve your deep sleep. Or what do you mean by it increases your deep sleep? It indirectly it means that okay, it is reducing your say stress levels, means your cortisol levels will come down. Next. Okay, so what are the why this happens, say, with meditation practices? So what are the things that it is there in meditation practices? These are the different components of doing a meditation. First is your attention regulation. Okay, in a very classical meditation practices, then you have your body awareness and emotion regulation. In a very lay language, I'll try to explain what are these things. Now, what do you mean by your attention regulation? Say, for example, you're doing a japa or you're chanting, okay, in your daily practice, or you're following any specific, say, any meditation method, okay, whichever you are trained with. Say, for example, I have asked to focus uh, on a mantra, or I have been asked to focus on a breath. Immediately, what happens? I'll be focusing on breath, but immediately my mind wanders. It goes somewhere. It will go to my office. Okay, it will start thinking about children, my grandchildren, or what all the things that I should do. And immediately again, I say, no, I have to do japa. I'll get back to my say japa again. Again, it drifts. It comes back. So this is our routine experience for all of us. Now, with this regular practice, okay, irrespective of age, I am telling you, right? It may take some more time with old age if you start any say meditation practices fresh with the old age. But this focusing and defocusing, right? It happens, and gradually now what happens? Your attention will increase. Attention is going to increase. Now, having this unwanted mind wandering, okay, which will facilitate for us to think about the past, say whatever the events that would have happened. See, one of the important feature also that we have to understand is that if we go on clinging our thought to the past event that would have happened in our life of negative, and always I think about that, I think about that, I think about that, right? We call it as a rumination, which is a risk factor for us to get into a negative mood or a depression, right? So that should not happen. If that should not happen, so what is the one thing is that I need to focus my mind on something else. What is that? Okay, this is the first step in your meditation practice. Why? What? Every day you start practicing, either focusing on the breath, focusing on a mantra, or chanting. I mean, whatever say you are familiar with, or you are in tune with this, but you go on increasing that particular duration. Okay, and if you go on increasing, say doing that your time for giving more time for this. Now gradually what happens that, what is the instruction? Instruction is, okay, you have to focus on a mantra. You have to chant a mantra. You focus on a breath or whatever it is, right? So slowly now, okay, so slowly now, so what happens is that, okay, your mind which was defocused, okay, you start immediately recognizing that, okay, no, my mind is defocusing somewhere else. Now let me focus on the mantra or breathing or whatever it is, right? So you immediately recognize that I have defocused, and you start focusing on that. So this will really help you to focus on whatever you need to be done. Otherwise, defaultly, our mind will be wandering. When by default my mind is always wandering and thinking about many other things, what will be the content in my mind? The content in my mind generally, okay, it will be about I mean, because we are more easy and attracted to the negative things, so the negative things or whatever that would have happened, okay, in our life, that will be ruminating in my mind, and this will cause a lot of uh, bad consequences psychologically and also physically. So therefore, first thing, okay, in any of these practices is your meditation uh, focus. Okay, focusing. What is it you need to focus? Okay, that you can decide. It can be on breath, it can be on mantra, it can be a sacred symbol. Okay, whatever that you like. So attention regulation is one of the very, very important thing that helps in focusing what needs to be done, and this will help to reduce our mind wandering. By reducing mind wandering, okay, what is that we are training a circuitry in our brain is, it will also reduce the negative rumination or the thinking in our mind. This is number one. The secondly is about bodily awareness. Now, what do you mean by this bodily awareness? See, one of the important aspect you do any classical, say, meditation practices is, when you start to say sit, when you sit for a meditation, so you are asked to focus on something, and when we start focusing on something, no, so something, say, it happens in my, say, body. So okay, what does it mean? I sometimes I feel very good. Sometimes I feel very pleasurable. Sometimes I feel bored. Sometimes I feel, okay, no, it's not possible. Let me so get out of it. So in some part of the body, okay, I may be having pain. In some, I may be having, say, numbness. Now, all these bodily awareness is, this information is what, okay, I know I'm focused, I know these things are happening, but what is the instruction? Instruction is you focus on either mantra, chanting, or whatever it is, right? So in meantime, what is the mental thing that we cultivate? So we cultivate to be to look. So these things that is arising in my body from a third person perspective means, okay, I'm feeling happy. Okay, let it be there. Fine, but let me focus on this. I'm feeling bored. Okay, let it be there, but let me focus on this. Okay, so I'm feeling, say, a little bit pain in this. Okay, to a certain extent I can tolerate, but let me focus on this. So this will give us another capacity for us to recognize what is my bodily language or what is my body is telling. So at the same time, it will also give us a certain other ability, right, to when to focus and when not to focus. So attention regulation and bodily awareness or your inner awareness, these are the two important skill, okay, that we develop with our meditation practice. Why this is very important? This is very important for us to understand that. See, whenever say we are suffering, we are having an anxiety or a depression, right? Our body will start giving a signal. It will tell, okay, now I'm getting angry, now I'm getting anxiety, my mood is okay, somewhat it is going down. So we should have that ability to recognize that and just try to say rectify it, or maybe if it is needed, uh, going for a expert say consultation, right? So therefore, attention and bodily awareness, these are the two important things, okay, that anybody so will develop with your regular say meditation practices or your religious say the practices. Okay, next slide. Next slide. Next. Okay. Can I go for next slide, please? Okay. Now, so when these things are happening, so we have to understand what we have to understand that in our brain, okay, this will help us uh, 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 to process very strongly our emotional processing also, because now you have a conflict in the mind. What is the conflict? So what is been told? You have been told to do a say chanting, okay, but my mind is wandering. I'll bring back my attention. At the same time, okay, I've been so there are a lot of distractions is happening. So we are negating all those distractions. But somewhere deep inside say no, 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 I have to go and watch something else. But the instruction is no, 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 you have to do chanting, right? So that conflict is there. So we also develop a ability of that conflict monitoring. So when this conflict monitoring it happens, it means that what? Means that we are in a better position for our emotional processing also to happen. So studies have shown that with these regular practices, areas that are involved in the brain that that regulates emotion, okay, will be very, very strong. So our attention increases, my self-awareness increases, and also my emotional regulation capability also increases with my meditation practices. Now, all these three are important, even irrespective of age, and also in the elderly age group. So, for us to have a uh, physical and say mental well-being. Next slide. Next slide. Yeah, can you go for next slide? Okay. Now other thing also that happens is what? Now, so with all these things, when our attention is increased, when I have a better emotion processing, okay, when I have a better say self-awareness, right? So what will happen? My stress will come down. When my stress comes down, right? Definitely my sleep also is going to increase. So this is one of the aspect. Okay. Now during sleep, what will happen? So during sleep, right, my heartbeat also increases and it comes down. So during my deep sleep state, what happens? My heart rate comes down, my blood pressure is it comes down. But when I'm dreaming, my heart rate will increases, my blood pressure also will increases. Now this increase in my heart rate and blood pressure during dreaming, so it has to be uh, immediately, it has to come down. So if my heart rate and blood pressure increases, say during early in the morning, okay, and if it is not checked, okay, then it is not really a good sign. So our study have shown people even with the age of 70 years, okay, 75 years, who have been regularly meditating, right, during early in the morning, when their blood pressure and heart rate is going high, right, it immediately it starts coming down. It will come down. It has to come down. Why it has to come down? See, body cannot afford to have a very high blood pressure and very high heart rate. Okay, then heart will stop, and also stroke and all those things will happen. That's why you see your heart attack, stroke, everything's are more early in the morning. Yeah.
Yes, sir. Absolutely correct.
Yeah. So therefore, with this regular practices, what happens? Our system will develop a capacity to reduce the heart rate and the blood pressure. Okay. Next slide. Yeah. Next slide. Next slide. Next slide. Yeah. Can you move on? I'll just say stop. Can stop there. Yeah. Fine. Stop here. Stop. No. Go back. Go back. Go back. Back. Yeah. Fine. Now, what I want to emphasize here is, see, even though I've told many things about meditation, I understand, say, suppose in the old age, it will be difficult, okay, to really start with any of these meditation practices. But very simple thing that is really works with for the old age, okay, will be your deep breathing practice. We call it, what do you mean by deep breathing practice? Okay, you take a deep breath in and breathe out. So breathe in and breathe out. Okay. Now, see, so what you're seeing here is diaphragmatic breathing and exercise. I'm giving you uh, the difference between the both. Now, with and what is the difference? With the deep breathing practices, what will happen? Your cortisol is coming down. What do you mean by cortisol coming down? Cortisol coming down means, okay, your stress level comes down. So the first and foremost thing is that whenever you feel very disturbed, okay, and your mood is really fluctuating, you are feeling anxious, okay, you are feeling very low, first and foremost thing is, okay, just sit and do a deep breathing practice. Okay, take a deep breathing for 6 seconds, breathe out for 6 seconds, breathe in for 6 seconds, breathe out for 6 seconds. Every hourly you do this, say, for 5 minutes, 5 minutes, 5 minutes, and 5 minutes. You see, in the next, say, for example, maybe in one month or 2 months, you start feeling change in yourself. A simple breathing practice, but it is definitely, it is going to help. What happens with this breathing practice? I told you, your cortisol will come down. Now, what do you mean by cortisol coming down? Right, your stress levels will come down. Number one. The second, what is happening? Your melatonin will increase. Now, what will happen if melatonin increase? What do you mean by melatonin? So melatonin is the one hormone which helps you in sleep, which is anti-aging, which is also anti-stress. So generally, with aging, what happens? Generally, because of aging, melatonin comes down. But with your deep breathing practice, you can increase to a certain extent your melatonin levels also. So your cortisol comes down, your melatonin will increase with deep breathing. When cortisol comes down, what will happen? So this will facilitate, it will create an environment in your body to fight the stress. So though there will be a lot of stress, yes, there is no doubt. Okay, but with simple breathing exercise, deep breathing exercises, your cortisol will reduce. Okay, your uh, the the capacity of your body to fight the stress will increase. Your melatonin is going to increase. And if so, when your stress is reduced and when melatonin is increased, so what will happen? You feel relaxed. Okay, you feel calmed. At the same time, it will facilitate your good sleep also. Okay, so therefore, your deep breathing practices, okay, is very, very important. Next slide. Okay, so with this, we have seen the people who meditate for a long period of time, their melatonin levels is also more compared to people who are not meditating. So it means that what? People who meditate regularly, people who try to focus on anything, focus on mantra, okay, focus on body awareness, do deep breathing practices, okay, their daily spiritual or religious practices, okay, they have more, we can expect more melatonin. When you have a more melatonin, it means what? You are anti-stress, anti-aging, and also uh, it's a feel-good hormone. Okay, next slide. Yeah, no, go for next slide. These things are not next. Oh, you're done. Okay, fine. I'll just tell you say a few say a few more say things with what can happen say with a simple uh, s- uh, sleep hygiene related issues also with the aging. Now, so you can see you can start your daily routine whatever it is. But if you want to increase sleep, okay, so before going to sleep, what are the things that you can do so that your sleep is also increased? Because sleep is the most basis for many other things which I told you earlier. So number one, okay, uh, just before going to sleep, right? Don't have heavy dinner. Okay, heavy dinner is not recommended before going to sleep. Just before going to sleep, okay, don't have coffee, tea, or anything like that. Okay, so your last coffee should be somewhere in the early in the evening, but definitely not after that. Now, having a good walk, a casual walk before going to sleep is very, very helpful. Third, just before of half an hour or 40 minutes before going to sleep, please shut down your mobile. Okay, don't see WhatsApp, don't get into YouTube, don't see the YouTube videos. Okay, all your electronic gadgets and everything should be shut. And especially for the elderly. So, and if you find okay, your sleep is very disturbed, you get up and you go to bed and you don't get sleep or for a considerable amount of time, then one important thing is right before going to sleep, okay, better to take a warm shower bath, or if you cannot take a shower bath, you dip your both the legs and also your both the arms, that is both the hands, in a tolerable warm water, at least for 15 to 20 minutes or half an hour. And then you can go for sleep. And before going to sleep, it's always okay, it's recommended that you can have a
You are muted. Doctor.
okay. And before going to sleep, right, you please do your say deep breathing practices. So your deep breathing practices, if you're doing any japa, if you're doing any say the bhajans, okay, and any puja and all those things, even if you can do before going to sleep also, it will be very, very helpful, because these things are like okay, your toxic, I mean detoxing say practices. So which will really facilitate for you to have a good sleep. Once you have a good sleep, and when you get up in the morning afresh, definitely your next morning will also be very good. Because why? Because your attention is increased. Okay, your memory retaining capacity will also increase, and you feel very fresh, right? And sleep generally will not try to intrude, okay, in your day-to-day activity. So why I have focused on only on sleep and see, otherwise meditation also has a lot of other beneficial effect. But why I focus on sleep is because sleep is the most commonest problem that we can see in the elderly. And just I wanted to focus these simple practices, if you can follow, how it can really improve your sleep, and it can manage your the stress. And if you can really bring about a good sleep, most of your other, say, 30 to 40% of the some of the health related issues can be tackled in a very, very efficient way. So the issue is now is what meditation practice that we have to do. We cannot really prescribe one meditation practice for all of you, but the recommendation, I mean, what can be really prescribed is whatever the religious, the practices or the spiritual practices or the routine practices that you're following in your daily routine, to please continue with that. On that, right, to please definitely add your deep breathing practices. That is very, very important. Number one. Number two, another very important practice that is really going to help, okay, like an immediate help for all of you, is your Om chanting. You chant Om, okay, and if you can do that, so that will be very, very good. Okay, so these two things is what I can really tell. These two, you can make it compulsory. What your deep breathing practice and Om chanting, apart from whatever that you are daily practicing in your everyday life. So deep breathing practice and Om chanting even before going to sleep is also very, very beneficial for you, even to get a good sleep also. And how frequently I have to practice? Okay, most of you are retired, you have a lot of time, right? If that is the case, right? Say every 2 hourly, once in every, say, 2 hour, okay, for 10 minutes do a deep breathing practice, and 5 minutes you chant Om. Then you engage in your own whatever the daily routine that you want. So every 2 hours, if you can really do this, so this will have a very cumulative effect. See, because if we want to have any good effect, we have to do that very regularly, and the effect will be cumulative. Uh, Effect of all these practices. Just because, okay, I practice morning on 5 minutes and evening 5 minutes, it is not going to help. So considering the age and considering the time that is available for all of you people, right? So I feel that every 2 hours, 10 minutes of deep breathing and 5 minutes of Om chanting. Every 2 hours, say 10 minutes of deep breathing and 5 minutes of Om chanting. And compulsorily at least half an hour before going to sleep. And compulsorily when you get up in the morning and before venturing into your other daily routine. If you can really do this, apart from your other regular practices, it will it will be very, very helpful. And when can you expect some results? Result can be expected, okay, once you after 2 or 3 months of your uh, regularly doing this. Today I do and tomorrow, okay, I have to, I, I will get the result. It's not possible, because we have to consider age is also one of the things. So whatever the new effect it has to come, it will take some time because of the aging issue, right? So you have to do it for almost for, say, 3 months or 4 months. If you regularly you do it, definitely, okay, that will be, you can start experiencing the benefits of this. Okay. So all those things will really take care of your, say, day-to-day stress and your and also the mood fluctuations. Fine. So this is what just I wanted to share. So thank you very much. Sorry for
Doctor,
the technical glitches.
Doctor, there are some questions in the chat box.
Yeah.
Can I read those questions, Doctor, so that you can answer, so that you can reply? Am I audible, Doctor?
Yeah, I'm just seeing the questions.
Please. Yes.
So Mr. Ramnath has asked what meditation to do before sleeping at night. I've already answered this.
I have
Your
answered that.
deep breathing and Om chanting will be very, very helpful.
Yes, Doctor.
Okay. And what type of KGR trust? What type of measurable indicators available that define well-being of the individual
I think you have also
while
answered.
meditation?
You have
Yeah,
answered
that's also I have answered. The
melatonin.
first and foremost thing, when you practice all these things is that you should feel very, very relaxed. Okay. I practice say for 15-20 minutes. So after 20 minutes, I should feel relaxed. Okay. Then in that case, okay, you have really practiced it. If you are not feeling relaxed, it means that you need to practice more. It is as simple as that.
Doctor,
Okay.
this Ram Shankar has raised one question, Doctor. That is regarding this REM sleep, etc.
Let me go one by one.
Yeah, please.
Most elder citizens are suffering from prostate between night 3 to 4 disturbed sleep. How to overcome this, please? Yeah, see, of course, frequent usage of the washrooms is very common in the elderly. One of the important thing is your BPH, where the prostate enlargement will be there, right? So for that, one important thing is don't consume water before going to sleep. That is any fluids for that matter. Okay, don't consume just before going to sleep. That is one thing. Otherwise, we don't have much say the how really that we can work, which is only we can prevent it. That's all.
Ram Shankar's question is this, Doctor. One of your slides shows that data related to Vipassana, medication, etc. It shows REM sleep increases to about 32%. What about NEM sleep percentage? I would have expected improvement in NREM rather than REM. That is his his doubt.
No, so there will be increase in both NREM sleep and REM sleep, but with Vipassana meditators, REM sleep is more. Okay, because that depends on the type of meditation that they practice. That's why I didn't bring all those details here, because I thought, okay, this talk should be more practically oriented rather than certain the other things. So see, therefore, I'll tell you, if you do a deep breathing practices, right, your slow wave will increase. Okay, it may not have much effect on your REM sleep, but your meditation is more focused on thoughts, right? Then your REM sleep will increase. So therefore, for your age, okay, for all of your age, for elderly people, okay, your breathing and Om is the best possible thing, which can be it can be done, rather than focusing on the thoughts and all those things.
Yes, Doctor. Sir, with regard to this, prostate problem, Doctor, we are shortly organizing one more program on that with some experts on that.
Okay.
We are organizing
Okay.
that is in the agenda.
Okay.
So, because almost all seniors face this problem, Doctor. Almost all seniors. Therefore,
of course.
It's
a natural thing. Yeah.
It's a natural thing, and I think it's almost compulsory. Any male, I think, after 55, he faces.
Yeah.
This is one nature has given to us as a gift.
Yeah.
Thanks, Doctor. So, any other questions, sir? I think Ram Shankar, your question is answered. And yes, I think can meditation improve the memory and cognitive powers of dementia patients? See, that is one.
No. See, the issue is whether the dementia patient can really meditate. I really doubt. But dementia, that's what I'm telling you. with mild cognitive impairment or dementia patients, okay, you can really train them in the deep breathing practice. That's why I'm emphasizing for elderly, deep breathing, om chanting, deep breathing, om chanting, deep breathing, om chanting. That will be very helpful from the practice perspective also.
Yeah. And and if sleep disturbs, I mean, that's one more question is raised. If sleep disturbs again and again, what kind of a meditation that we can take down? See, people also
No,
say,
if the sleep is getting sleep is disturbing again and again, we have to evaluate that why it is getting disturbed.
Yes. Then okay, then probably some sleep study needs to be done.
We don't know whether sleep study is done, but we need to understand that why it is getting disturbed.
And Ganesh has asked, is it okay if you chant for home chanting for 5 to 10 minutes?
Yeah, no problem. If you have more time, you can chant more also, no issues.
No issue. And home chanting should not be taken as a religious issue or something like that. It is a religion.
Definitely, we have to understand all the syllables should not be taken as a religious issue at all. This has a very, scientific evidences are there, empirical evidences are there. Anybody with any background, you chant Om, it has an anti-stress effect on a person, whether irrespective of his say religious or philosophical background.
Yeah. So therefore, I mean, that it is religion neutral. That's what I will say. That home chanting
it is neutral. That's what I'm telling.
Yes, doctor. Thank you. Thank you. I mean, then if you have a deep stress sleep, we will get it that this. I mean, if you have deep stress, will sleep get disturbed?
Definitely, stress will disturb the sleep.
I see. Okay. So yes, doctor. Thank you. I think you have answered almost all the questions.
And also the other thing is, just wanted to convey, because we are also doing a study on cognitive impairment and sleep. So those who are, who are interested to volunteer to this study, even it can be a normal aging also, or it can be with this cognitive impairment also. You're most welcome, right? The only thing is, okay, you have to nap in our lab. That's all. Not a whole night. Night sleep. Whenever you are convenient, you have to come to the lab. You have to just nap in the lab. So that's what we expect, and I just offer, say, this one opportunity. If anybody of you are interested to volunteer, so you can please contact me, and I'll just put my
Cell number.
phone number. Phone number in the chat box. It is there. 944-893-4488 is my phone number. I hope at least there will be few people who are interested to volunteer and to help us to generate the new evidence and new knowledge for the good of the society.
Yes, doctor. Yes, thank you, doctor. In fact, I can tell our audience that I have volunteered and I have done both the tests.
Yeah, Dr. Jambunath has volunteered, and so he knows that it is very simple. Come, we place some electrodes, and you just sleep in the afternoon. That's all.
That's
nothing else.
And doctor, for the other tests, I think there is some age restriction.